Online reviews are an important part of getting new clients, especially as a healthcare practice. More than 77% of patients use online reviews as their first step in finding a new doctor, according to recent research from SoftwareAdvice. While client reviews help gain new patients, they can also pose a problem if you get complaints. Unfortunately, you won't always have glowing reviews, but you don't want the negative feedback to scare others away. But the way that you respond to complaints can make all the difference. If you stay professional in your responses and show that you take patient concerns seriously, you can still win over clients. Hi everyone, I'm Matt from eTactics, and today I'm going to tell you about 9 tips to keep in mind for how not to respond to patient complaints. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. The first thing you want to avoid doing when responding to patient complaints is becoming confrontational. You might have the urge to do this in the heat of the moment, but it will backfire on your organization later. If you look aggressive on a public platform, people definitely won't trust you that you'll have the patience when dealing with them for a private visit. Similarly, you should never become defensive. Naturally, you'll want to defend yourself, especially if someone seems to be attacking your practice over something that just isn't true. But getting defensive makes it seem like you're dismissing the patient's experience. Even if you think the person is wrong about the type of service you provided, it doesn't help to express that. Both the patient and viewers will think that you don't care to solve the situation. Just as you shouldn't get over emotional about their negative feedback, you also shouldn't respond too lightly. This, again, makes it look like you aren't taking their experience seriously. They were upset enough that they posted about the situation online. This means you need to be just as serious about the complaint. Don't make jokes or brush off the problem. Using the poor response behaviors that I already mentioned in this video would seem emotionally dismissive to the person who posted the complaint. But you also shouldn't ignore it altogether. Responding in the first place and with an understanding attitude shows that you're trying to resolve their problem. To be frank with you, many people don't understand technical medical terms, since 47% of adults lack intermediate health literacy. If you write a response loaded with this medical terminology, people won't understand what you're even talking about. They may also feel like you're talking down to them, trying to correct their concern by showing off how smart you are as a doctor. But you're a doctor, so we get it. Patients will appreciate a response in plain language that they understand, though. They won't end up confused, which would just give them something else to complain about. In most cases, you shouldn't delete reviews. This makes it seem like you're hiding the real experiences that people have at your practice. It makes you appear dishonest and like you don't want people to know the truth. Although in some situations it is acceptable to delete online complaints, posts that contain profanity, slander, threats, or other offensive content should get removed from public forums. Altering content is just as bad as deleting the complaints. Again, people lose trust when businesses aren't honest with the reviews that they receive. Altering them affects your credibility because the poster will know that it isn't what they originally said. In other cases, a review might contain protected health information that you can't address within a response. Acknowledging or repeating this PHI online would violate HIPAA if you didn't first receive authorized consent to discuss it. This makes it difficult to properly respond to a complaint. Now, you don't want to just ignore them since that would make it look like you don't care. But you also don't want to cause an unintentional HIPAA violation. It's also inappropriate to reference staff performance. Sometimes a patient might complain about an employee or a situation that resulted from an employee's actions. It can be tempting to throw that staff member under the bus to save face for the rest of your practice. But this will backfire. Engaging in negative comments about your staff would also make them lose trust in your company. There are often interactions that need to happen away from a public platform. However, you need to still be cautious about how you contact these people. Discussing PHI through email also poses security risk, so you shouldn't contact the patient this way about their information unless you have their consent. Now, if you'd like to learn more about the do's and don'ts about replying to patient complaints, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. But what are you waiting for? Subscribe to our YouTube channel.